Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, what a set of topics. How about this? Patient safety, Haiti relief, and the end of the legislative session. All of that and more. Pennsylvania politics, in depth and detail. And guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Welcome back to the program. I'll get that out all right. All right, what a program we have. All right, we're going to start. Sitting across from me is Scott Detrow. He's with Pennsylvania Public Radio. He's one of the state's leading reporters. The legislature is gone, at least until January, the end of a session. Scott Detrow, what a finish.
Yeah, they went out with a bang. We had a veto override, the very first of Governor Rendell's administration. Yep. We passed a major pension bill. Right. They elected new leaders, and they ousted Dwight Evans, who's been in a position of power in the House for 20 years. That's all in the span of a few days.
Yeah, I mean, yeah, they don't do anything for weeks, and then they come back and have this. All right, let's go through some of these very quickly. The pension bill, it's a huge deal. It was fairly controversial. There are pros and cons to it. It involves state employees and school teachers, some 400,000. Give us some of the highlights of that.
The highlights are, this is something that the unions like because, one, it keeps the pension system in place instead of shifting them to a 401k-like defined contribution system. Right. Two, it doesn't touch anybody's current pension. This is only for people who get hired after a certain point in time. So it decreases the payments that it decreases the benefits, rather. It increases the retirement age and the vesting period, right. But it also spreads out these payments that are due for a couple decades.
That's where some of the criticism went, that it's just adding $30 or $35 billion over the long haul. That was one of the big criticisms, right?
Right. Generational theft is the term that conservatives were throwing around.
You have to worry about that. I don't have to worry about that. You're a lot younger. All right, let's go to the second issue. The second issue has to do with this veto of a bill that had 10 or 12 education things in it that Governor Rendell didn't like one aspect of it. What was that?
Right, an omnibus education bill, so it had something that every lawmaker liked here or there, which is kind of the reason for the veto. Governor Rendell said he had a problem with language that would grant tax exemptions to landlords who rent out space to charter schools. He said two things. One, this will hurt school districts and lose them money. Two, it's unconstitutional because you're saying a charter school is different than another nonprofit. Right. So he vetoes it. The House overrides the veto as their last vote of the year.
Huge, too.
Yeah, and then that puts Dominic Pileggi, the Senate Majority Leader, in a spot because he's been saying since February, we're not going to come back. Yeah. We are not coming back. And then all of a sudden, they have this veto override, so he has to start getting tricky. They do come back, and he says, well, look, this is a bill. None of the wording has changed since we voted on it in September. This is not like we're taking a new bill up.
But the first and only veto override of an Ed Rendell veto, correct?
That's right. He's
like
vetoed
35 or something like that.
35, maybe one more on Castle Doctrine. We'll see.
Oh, that's right. We'll see. All right, about 45 seconds to go. Shift in power in the Pennsylvania legislature from the east to the west. The population is mostly in the east.
Allegheny County is the place to be right now. The governor-elect's from Allegheny County, the majority and minority leader in the House from Allegheny County, and the Senate minority leader, Jay Costa, elected earlier this week, also Allegheny County. You're going to see some funding there, I think it's safe to say, if there's any money left.
You got it. Great update, Scott Detrow. All right, patient safety, what a topic. It's hugely important. We're going to give you some tips. We're going to talk about that following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're going to turn to a very, very important subject. I think it's something that everybody should be concerned about. It's called patient safety. Sitting across from me is Mike Doering. He's the executive director of the Pennsylvania Patient Safety Authority, and Deborah Donovan. Deborah is Director of Provider Quality Performance Management at Highmark. Has title longer than some professors I know, but we always joke about that, titles on this program. All right, Mike, for our viewers, talk about the Patient Safety Authority. I always ask this question when we get into these. Why should we care? And you're going to tell me, I know.
Sure. We should care because patients, when an individual goes into a hospital or facility, they want to be treated for the illness that they have. They don't want to get another problem. Mm-hmm. And as it's been well documented with the Institute of Medicine, et cetera, that many things happen to patients when they're in a facility, when they're in a hospital, that shouldn't happen. Mm-hmm. You know, the wrong type of medication, someone has surgery on the wrong body part, et cetera. These things still happen. Mm-hmm. And so our job and our mission is to collect information about that and try to educate and train facilities and the consumer to some degree on how to improve patient safety within the facilities.
Mm-hmm. Now, is patient safety related to health care coverage, you know, to insurance coverage in general? We can talk about Highmark. What is the trend in your industry supplying coverage to people with regard to patient safety?
Well, it's certainly a huge component of the work that we do, and specifically for Highmark, Highmark has aligned with the Centers for Medicare and Medicaid Services in terms of reimbursement. So for hospital-acquired conditions that occur within a facility, such as a surgical site infection, mm-hmm. we would not reimburse the facility for that higher level of payment based on that condition.
Now, is this just Medicaid and Medicare services, or would that be spread out, you know, if a person just is insured
Sure.
by Highmark, let's say? I am, by the way, just want to make that clear. Go ahead. So you
Sure.
got an interested consumer right here. Go ahead.
It applies to across our entire book of business.
Okay.
So,
all right, let's talk about how this, how does this actually work? I mean, you say that there are folks who report this data to you. Is that correct?
That's correct.
And they're required to by law?
Mm-hmm. All hospitals, ambulatory surgical facilities, birthing centers are required to report patient safety events,
yeah.
whether there's harm to the patient or not.
Yeah.
And we get about 220,000 reports electronically through our system from the facilities in
Now, are these
Pennsylvania.
regular reports, or just if they're quote incidents? Are they reporting all sorts of aspects of health care to you?
No, it's all about some type of event that was patient safety, something that should not have happened.
I got it.
Okay, within the hospital, within the facility.
But you know, when we talk to other people in the medical community, I mean, there seems to be, you know, both in hospitals and with physicians, a lot more concern about this than we've seen. It seems like, you know, of course there are always problems, but it seems like it's getting. I mean, they're getting better at this. They're getting much better. They're much more acutely aware. Am I correct about that?
you're correct. They're much more acutely aware, but there is still a significant problem. So when we look at some of the publicly available reports, and Pennsylvania is one of the states that does publicly display information for consumers, it still happens on a regular basis, so still a lot of work to do.
Yeah, how many, is this a common, this authority, Deborah brought up an interesting point. Are we similar or dissimilar to many other states in terms of having, or if maybe you don't know?
Well, in terms of medical errors, we're very similar to other states. I mean, it happens everywhere. It happens in every country.
How about reporting to an authority such as yours?
It's a little bit different in Pennsylvania. We probably have the most aggressive reporting program in the country, in that the facilities are required to report near misses to us, where there wasn't harm to a patient. And the 220,000 reports that we receive a year dwarfs what's reported in other states.
All right, we're going to run to a break. When I come back, there's a cost to this. I mean, there's also a human cost, but there's also an actual cost. And we're going to delve into that. All right, patient safety, and then coming up, Haiti relief with our friends from the Credit Union Association. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. We're chatting about patient safety, something we've done in the past and something obviously I think we'll continue to do in the future. All right, let's talk a little bit about what kind of an approach should be used to when we talk about patient safety. I mean, obviously, you don't want to create a competitive situation. You want to create more of a sharing. What's the philosophy of your operation on that?
Yeah, one of the things that we've tried to push, and I think that Highmark has as well, is that patient safety is, it shouldn't be a marketing gimmick for a facility to say, we're going to keep all of how we do things, close to the vest.
Oh, sure.
And that we really want the facilities, the patient safety officers to share with each other, to share the successes. And we have a group of patient safety liaisons, we call them, that are out in the regions.
Right.
And they take our message to the hospitals. And one of the things that they try to do is to get the patient safety officers in the facilities to share their successes, to share their policies and procedures, et cetera.
And, there's, in all of this, in all of healthcare, I mean, there's this huge emphasis now on reducing costs. We're having this big debate, which we've entertained on this program, about whether affordable care, the National Health Care Bill passed in last March is going to lower costs, raise costs. Some say insurance costs are going up, because of the addition of folks to the health care insurance in coverage that, weren't covered before, pre-existing conditions, keep the kids on and all of that. We don't need to get into that specifically, but do you think that patients, what's the relationship between patient safety and cost to the healthcare system, and what does it mean to an insurer such as Highmark?
It's huge. So, for example, for Highmark's Quality Blue program in the past 4 years in averting central line infections or MRSA infections, again, hospital-acquired infections, we've seen a reduction of about over 2,000 infections in our facilities, and it equated to about $52 million in avoided care costs.
So in other words, some of what Mike has been talking about that, it has resulted in closer attention and better success rates at reducing these problems. I mean, is that the conclusion you reached? That, in other words, and who knows, there are probably lots of complicated reasons why we're getting better at it throughout the entire healthcare system, but is that the conclusion you've reached?
It is. Healthcare is a complicated business, and so to Mike's point, we always want to try and find ways to streamline and improve efficiencies to then hopefully make improvements. And we look at it as we want our hospitals to steal shamelessly from each other, so that nobody has to recreate the wheel, make the same mistake, and if there's a way to do that, that's what we're all about.
Yeah, the other aspect of this is the degree to which Pennsylvania fits into this national picture, where we have more. I mean, on a scale, do we rate, among the states that are more energetic in pursuit of this as compared to other states? Where do we fit with other states?
I think Pennsylvania's been very aggressive, and the legislature that set up the Patient Safety Authority and through some of the laws in terms of reporting, I think Pennsylvania's been very aggressive, not only in the amount of things that are reported, but also in educational and training and the other things that we've been able to do.
All right. Well, look, thanks for coming on. This is a good update. We'll continue to keep track of this, and we have talked to the folks from the Hospital Association. As they've responded to this, we'll continue to do that as well. All right, Haitian relief. We're going to delve into this, a couple aspects of this you might not be aware of. It's a topic that may be off the front pages, not off the front pages here. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. All right, from patient safety to Haiti relief, there may be a connection there. We're going to chat with Chris Wood. She's the CEO of the Keystone Federal Credit Union in Westchester. And Joseph Wambach, not the author, I want to get this clear, the executive director of the Pennsylvania Credit Union Foundation. All right, on to a very serious matter. Look, Haiti's, Joe, I'm going to start with you. Haiti's off the front pages. It shouldn't be, but it is. And there's still a hugely serious problem down there. Describe briefly what the situation is.
Well, the first problem, and that it has come back on the media, Terry, is the cholera outbreak.
Yep.
That actually occurred a day after we left the country, and it began about 10 days after we had been in the St. Mark area of Haiti, where the outbreak first began. Now, of course, as you've heard, it spread to Port-au-Prince, also to the Dominican Republic, and I believe yesterday there was a report that there was a case in South Florida. So that's certainly reprehensible.
Now you all were there, correct?
We were.
And you saw this firsthand, so we're not getting some second-hand account. The devastation that was reported, you know, after literally brought about the collapse of the entire country. Is that a fair assessment?
That's definitely a fair assessment.
What did you find when you went there? I mean, we hear this tent cities and
that's accurate. I don't think you can really picture it until you get off the plane and you start driving. There are tent cities, there's rubble everywhere. There's not a lot of clearing. There's people living in tents in little metal shacks along the side of the road. It is most disturbing.
And you went there did you link up with some Haitian credit unions? Is that what you did down there? How did that all work, and what did you go there for?
Well, we went there for basically three reasons, Terry. There was a personal reason that involved my spouse, who is a Haitian and who is a physician.
Oh, wow.
We visited her village and found out that several of the relatives were in bad shape. One had malaria. The other one had been apparently ripped off, and his school had been trashed by people in the neighborhood, so we got down there at an opportune time. But officially we were down there at the behest of the Pennsylvania Credit Union Association. Right. And the reason we were there, but two reasons. First of all, to look into the remittance system, remittances being transfers of funds from Haitians in the United States to their loved ones in Haiti. And secondly, in order to evaluate the condition of Haitian credit unions, of which there were originally 165. Now they're down to less than 30 because of the disease and because of the problems that resulted from the earthquake. So we were down basically for those three reasons.
And when you were there, were you there basically for the same reason as part of this mission?
It was part of the trip. I have a lot of experience in credit union operations, so I was more of the technical part of the team.
So let me put this in perspective. You know, this is fascinating because this is an angle that I don't think most of our viewers, I'm certainly learning this for the first time, not that I can't learn a lot of things for the first time, but normally you think we're going to supply aid, you know, we're going to bring, agencies will bring food, bring, clothing, bring medical supplies, medical services, but you're talking about a little different angle here that's pretty important. You're talking about money being sent from, let's say, America, from credit unions down to Haiti. How is that money then being, delivered to the folks who it was intended to receive? Do I get into that with you?
Yeah, you've got that, Terry. The Pennsylvania Credit Union Foundation, whom I represent, does have technical expertise in terms of disaster relief activities. As you know, and the Mennonites, it's a bit similar to what the Mennonites do, our own Mennonites. They take the funds down that they receive and they actually implement them, and they give them over directly to the beneficiaries. We've had a bottleneck in Haiti, as you've probably heard. There's over $1 billion that has not been allocated because people are unsure as to how best to use the funds.
Right.
And there's also that reputation that the Haitian government has garnered over the last 50 years.
So you went through, you know, we won't get into the politics of it, but your point was you're going to go down there and you're going to make sure that these transfers are made and that the money is getting to the people who, you know, deserve, you know, who are supposed to get it.
Well, that was part of it. The other thing is there are mechanisms in place right now to get money down there, but they're expensive, and they're not always the best way to do it. And truly, to fulfill our credit union philosophy of people helping people, we want to make sure that it's direct, it's as inexpensive as possible, so that they can begin to rebuild.
Yeah, one of the things about that, you know, again, not getting into the politics of it, but avoiding sort of the government apparatus and delivering the services directly to the people. And that, I think, was your big takeaway from this, right?
Yeah, that's correct, Terry. As unfortunate as it is, the government at this point in time is simply incapable of implementing aid. And we want to make sure that that aid from Pennsylvanians is directly delivered to the beneficiaries. And the recommendations that we will be making will be made on that basis, as well as, of course, using our World Council of Credit Unions organization in order to deliver goods and services.
And that's
to
a
Haitian
partnership,
people.
right? You've got this partnership between credit unions in our country, and obviously your concern would be Pennsylvania. Are credit unions around the country doing this as well? Or are you a leader in this? I'm going to give you some shameless self-promotion time here. That's okay. Go ahead. Go ahead.
Let's shamelessly self-promote then.
Do it.
Credit union philosophy, both locally and globally, is people helping people. So what this really does is allow us to put this into play internationally. And it starts with something as small as my own credit union, where the board donated my time to go down because they believe in this philosophy. That is throughout this nation, and it's throughout the world through the World Council of Credit Unions.
Yeah, we have about 45 seconds. Success, did you rate your visit? Did you accomplish what you wanted to do?
We believe we did, Terry. We were able to visit not only the leading group called Olivier that's responsible for remittances in Haiti and works together with the central bank, but we also visited 15 credit unions in order to determine the work that we could do specifically with at least 3 to 5 of them, which is our real target that's been established by the Pennsylvania Credit Union Association. So the answer is yes.
And you're going back? You're going back?
I would love to go back. We need to make a difference in these people's lives.
All right, there you go. Hey, that's a great update. Yeah, you know, I always try to learn something. I hope our viewers do too, but I learned something today. All right. Hey, thanks for watching Pennsylvania Newsmakers and always, and we'll see you next week, and stay well.